2 minutes, 2-minute warning.
Good afternoon. I'm Mandy Cohen, Secretary of the Department of Health and Human Services, and I'm joined by Director of Emergency Management, Mike Sprayberry. Brian Tipton and Nicole Fox are our American Sign Language interpreters, and working behind the scenes are our Spanish translators, Jasmine Matevier and Josiah Melendez. I hope, Jasmine, you're having a well-deserved day off. I'll start with a rundown of the numbers. As of this morning, there are 38,171 laboratory-confirmed cases. 780 people are currently hospitalized, and sadly, there have now been 1,053 deaths. It was another high day of cases and hospitalizations, as you can hear, for the state. We had 1,011 new laboratory-confirmed cases, which was our fourth day in the last week where we exceeded 1,000 cases, and it was our highest day yet of hospitalizations. I continue to be concerned. Many of our neighboring states in the Southeast are seeing similar trends. It is a reminder that COVID-19 is still a powerful threat and that this virus is going to be with us for some time. There are clear steps we can take to protect our loved ones and neighbors to slow the spread of the virus. The first step, and core to our strategy to reignite the economy, is to practice the 3 W's. Wear a face covering, wait 6 feet apart, and wash your hands frequently. We need to take these actions every day, all the time. This virus continues to be spread by people who don't know they have COVID-19. Wearing a face covering stops you from unknowingly spreading the virus to others. The second step is testing. Make sure you get tested when it's needed, and stay home and away from others if you have COVID-19 or if you've been exposed. We continue to ramp up testing. In the last month, we have more than tripled our daily testing average from 5,000 a day to 15,000 per day. We also have about 400 testing sites on our website. Now we need to make sure that people are going to those testing sites and getting tested. We shared updated guidance yesterday with our doctors and clinicians on who should be tested for COVID-19. We want to rapidly increase testing for people who may have been exposed to COVID-19 but are not having symptoms, especially people from historically marginalized populations who we know have been disproportionately impacted by COVID-19. In addition, people who live or work in high-risk settings like long-term care facilities, correctional facilities, or in settings where they have higher risk for exposure like grocery stores, food processing plants, childcare, should get tested. And anyone who's attended a mass gathering, including a protest, should get tested. The third step and thing that we can all do together is to answer the call from your local health department. That's so that others that may have been exposed get the support and resources they need. As we see our trends starting to go in the wrong direction, we are responding on multiple fronts. Statewide, we continue to build our testing and contact tracing infrastructure, but at the same time, we need to respond to our data and surge additional testing and tracing resources to several targeted communities and populations that have been hardest hit by COVID-19. Our first round of partnerships is with a mix of several of our urban population centers as well as our rural communities. Counties like Mecklenburg, Durham, Wake, Forsyth, Duplin, Lee, and Johnston and Alamance counties. While these are a few communities that we're working to surge some additional testing and tracing capacity to this week, we know there will be more to do. We can protect our families and our neighbors and slow the spread of this virus if we all do our part, starting with the 3 W's: wear, wait, and wash. Please continue to take care of yourself and those around you. Stay well. And now over to you, Director Sprayberry.
Thank you, Madam Secretary. Today is day 93 of the State Emergency Operations Center's COVID-19 response. Among other activities, we are supporting the critical effort to increase targeted testing and contact tracing, developing the strategic state stockpile plan for PPE, and preparing for a hurricane response in a COVID-19 environment. We've seen significant improvement in the past few weeks in the availability of personal protective equipment through existing supply chains. We continue our daily shipments to counties and healthcare preparedness coalitions to meet their resource requests. Yesterday, we delivered requests to 24 counties and 1 coalition. Items received in our warehouses yesterday included more than 100,000 face shields, 66,000 isolation gowns, 600,000 gloves, and 119,000 N95 masks. We now have at least a 30-day supply of all the key PPE items, and we are showing green checks on the dashboard for face shields, gloves, gowns, N95 respirators, and procedure masks. For some of these items, we have supplies to last several months. This is good news, and I'm thankful to the logistics and sourcing teams that have worked so hard to get us to this point. This week, FEMA granted us another 30-day extension for our non-congregate sheltering program. That's more great news. Right now, more than 40 counties are using the program to shelter more than 1,000 people in hotel rooms in order to prevent the spread of the COVID-19 virus in their living environment. The program can be used for medical workers and first responders who may be exposed and don't want to spread the virus to their families, or for those individuals who have sustainable or stable housing issues. You will also see it used during this hurricane season if we need to evacuate any of our coastal areas. I want to mention our state's food banks again today. It's been a while since I've talked about them. They still need your help as they are working to feed a growing number of families who are struggling to put food on the table during this pandemic. The North Carolina National Guard continues to support food banks with manpower, logistics, and transportation, but the food banks need your help financially to get the food supplies they need. You can donate to a food bank near you by visiting feedingthecarolinas.org. That's feedingthecarolinas.org. Thank you for your generosity and their ongoing time of need. Like Madam Secretary said, Remember to observe the 3 W's, so important. Wear a cloth face covering, wait at least 6 feet apart, and wash your hands often. That's wear, wait, and wash. With these simple yet effective tools, we all have the ability, as individuals, to slow the spread of the virus and get our trends headed in the right direction. We have the power. As always, don't forget to look out for your family, friends, and neighbors, and to call your loved ones daily. Guaranteed they'll appreciate it. With kindness and cooperation, we'll all get through this together as one team, one mission, and one family. And now back to you, Madam Secretary, for questions and answers.
Thank you, Director, and we look forward to your questions.
Our first question will be from Rose Hoban with North Carolina Health News.
Hi, Secretary. Thank you for taking my call. We understand, I have 2 questions. The first one is that we're seeing more cases apparently from construction sites and from farms. And what is the state doing? And the second question is, which counties did Deborah Birx express her concerns over? We understand that she cited a handful of counties that they saw the numbers going up.
Great. Well, thanks, Rose. So first, in terms of us seeing more viral spread at places like construction sites or at farms, yes, we're tracking a number of places where we are seeing more viral spread. And I think it goes back to these core elements of, the 3 W's, getting testing and getting testing to people in their community in a way that's trusted, in a way that's culturally sensitive, that linguistically appropriate, that folks understand what it is, and then also to help folks with isolating. I think Director brought up a very important point about the non-congregate shelter options for counties. I'm excited to see as many as 40 taking advantage of it. I want to see even more take advantage of this federal support, right? It's federal dollars that support non-congregate sheltering. I think that's going to be really important as we continue to go forward here. So we want to be surging some of our testing capacity, but it's also a matter of having folks understand that testing is an important component here. I think you likely know, as I said, we have 400 testing sites, but it's not like we have lines out the door or we have waits at our labs. We need to make sure folks know that there is capacity. We want them to get tested, that these kinds of occupations can lend themselves to more exposure. So we want to make sure we're getting out the message, hey, testing is really important. It can tell you that you have COVID-19 when you might not even have any symptoms. And so I think we need to keep that message up. And so we're working with community partners all across the state. I actually had a wonderful conversation with a lot of Latinx community leaders just earlier today about how we can partner together. And there's so much work to do. And we're always wanting to get better as a state to make sure that we are appropriately responding, particularly as we see our historically marginalized communities difficult to, disproportionately impacted by COVID-19. As far as the White House flagging certain counties of concern, yes, I believe the White House Coronavirus Task Force, has data that they look at. The CDC has data. The Assistant Secretary for Preparedness has data. We are getting data all the time, and frankly, they all look at slightly different viewpoints, and I think it's because they have access to different databases. What our team tries to do is synthesize all of that data, as well as obviously our own. We are closer to the ground, and we rely on our local health departments who are really at the tip of the spear to tell us what's going on in their individual communities. But we try to synthesize all of that data where folks have different, like I said, vantage points, and to say, hey, what are our trends telling us, and how do we surge resources? And frankly, the numbers are changing so often, so are those needs in terms of surging resources. So we're trying to build better muscle here at the state and in our local communities to make sure that we have the ability to surge resources, move them around to places that we may need them. Obviously, I think our urban centers are always going to be a place of needed attention, right? It's where most of the people are, but it is where folks are closer together just by the nature of how we are all living in urban areas. So those are going to always continue to be areas of focus, the Triangle, the Triad, and the Charlotte area. But we know that there'll be others that we need to focus on. But this is not an exclusive to our urban county issue. As you see, there's places like Duplin County or Lee that are on the list that we want to make sure to focus on as well. And I'm sure as the data continues to evolve, there'll be other counties we'll be wanting to focus on and make sure they have the resources that they need. Thank you.
We have a follow-up question from Rose Hoban, again with North Carolina Health News.
Hi, Secretary. I was just wondering, did Deborah Birx mention, we understand that she mentioned some counties specifically, and we were wondering what counties she was focused on.
She mentioned 6 in particular. So we were focusing on 8. As I mentioned, we look at a bunch of different data. We overlap very much with some of the ones that she had on her list. It was some of our more urban areas, but I think I want to believe that Lee County was one of the ones that she mentioned in particular. So that is why we try to synthesize that data. And again, CDC has their own sort of way of looking at the data and helping us prioritize. And everyone is a little bit different. I think what we are seeing across our state, we're seeing trends go up in lots of places, and we are needing to utilize this infrastructure that we've been building since the end of March. And we're going to need that everywhere. But we know that it's not enough. And it is why we have an RFQ, a request for vendors to work with us on surging our testing and tracing capacity even further. I think we've done a lot of really good work to this point, but we know there's so much more to do, which I know everyone is feeling weary from COVID-19. We've been at this a long time, but we see the trends going the right direction, and I think we are transitioning into this phase of needing to respond to those trends, and we'll continue to do that and ramp up those efforts. Thank you.
Our next question will be from Jonathan Alexander with the News and Observer.
Hi, Dr. Cohen. This is Jonathan Alexander with the News and Observer. In regards to Ace Speedway, they hadn't yet publicly acknowledged that they have been closed. What action will the state take if there are races with the crowds this weekend? And also, has DHHS received word from Ace Speedway owners that they are closing the facility?
Jonathan, thanks for that question about Ace Speedway. As you know, this is a raceway that has had continual events where they've brought multiple thousands of people together, shoulder to shoulder, no masks. And I do want to say that mass gatherings are high risk. We've known that. And whether that mass gathering is at a raceway or at a protest, those are high risk events, and they are concerning in terms of spread of virus. Now, but there are certain things, as we have come to understand under our law, that have certain constitutional protections, like a protest. So those are things that are going to continue to go on, but they are risks. What we're seeing with Ace Speedway, right, we tried to work with the Speedway to say, hey, there are ways you can run this race. We worked with NASCAR to do that successfully. They ran the Coca-Cola 600. They did it without spectators. They used tons of face coverings, social distancing, signage. I think they did a terrific job. And so what we want to do is work with these organizations to say, how can we help you still manage to have those races, but do it in a way that doesn't threaten public health. And, despite that, they continued to, despite the local health department working with them, despite us sending letters of concern, they continued to run the race. So we did have to issue an abatement order this week. We haven't been notified that they have been closing, so that will escalate to some additional legal steps we take in court. And I believe that there will be a hearing on that tomorrow, and so we will let the lawyers take that from there. But we're trying to signal our concern about public health, and it doesn't take away my concern for other places. Right, mass gatherings are going to be risky in all settings, and that's why we are very much wanting folks who may have been at a mass gathering to go get tested. And again, the reason for that is you can have COVID-19 and not have symptoms. We have testing capacity in the state. We have 400 sites in which you can go get tested. We've revised our provider guidance to really lean in on testing, and we're continuing to ramp up our capacity to do even more. If you can't hear my voice, testing, I think, is going to be critical to this, and we want to make sure that everyone stays focused on it and realizes and thinks to themselves, hey, might I have had an exposure? How do I go start to think about getting a test? I'd encourage you to go to Find My Test location on our website and check your symptom tool. I think all of that will help answer some questions, and we hope folks will be getting tested. Thanks.
We have a follow-up, again, from Jonathan Alexander, News and Observer.
Dr. Cohen, what are those legal steps that the state may take, and does that mean the state may sue Ace Speedway?
Thanks, Jonathan. Yes, I believe those steps are already in process. I'm not the lawyer, so I'm going to maybe use the wrong terms, but I know the Department of Justice is working on this on our behalf and filing a complaint saying that Ace Speedway is not following our order. So I believe those court filings have already happened, and that's then the hearing that will happen in court later this week. But we'd be happy to follow up on the specifics, so the non-lawyer in me doesn't get the details wrong there for you. Thank you.
Our next question is from Brian Anderson with the Associated Press.
Hi, Dr. Cohen. Thanks for the accessibility and taking the time. I have a couple questions. And just following up, do you have the names of the 6 counties that Dr. Birx recommended? And could you repeat those 8 that are in North Carolina that you've already been tracking? And will there be a breakdown by job sector or occupation, or does the state not have that data that it's recording as far as COVID cases? And then I'll have a follow-up question for you after.
Thanks, Brian. So the 8 counties, and let me read them directly from my remarks so I don't get them wrong. Mecklenburg, Durham, Wake, Forsyth, Duplin, Lee, Johnston, and Alamance. And so those are 8 counties. I believe we talked about a subset of those when we were talking to the White House. Again, the White House Coronavirus Task Force, I'm sure they have data sets that they pull together and have counties that they watch. But we were appreciative of the call to say, hey, we are concerned. Here are some counties of concern you should think about. We were already there in terms of thinking about how do we surge resources. As you can see, we took our own data. We took feedback from the CDC, as well as Assistant Secretary for Preparedness and Response, also at HHS. Again, each of them sort of see the data puzzle a little bit differently, so we wanted to make sure we were incorporating what they might be seeing that maybe our data isn't showing us. We put our data together with this, and again, these 8 counties are really a first step. So I don't want folks to overread that these counties did anything wrong. I think there's been really good and hard work going on, and all it means is that we want to, as a state, be working with them in partnership to surge additional resources as we go here. And as far as the job sector breakdown, I wasn't sure if you meant as a part of the testing. We certainly break down some of the job sectors in our guidance, saying, hey, folks who are in these kinds of higher risk jobs, like working at a meat processing plant, or who work in a grocery store, or who work in one of our high-risk settings like long-term care, those are the folks we really want to get into testing right away. Often we're not able to capture job responsibility in the way we're tracking data. Obviously, we're trying to track on a whole variety of metrics, including race and ethnicity and gender and age, county location, et cetera. Often we can capture once we do a contact tracing. So we are trying to get better visibility once we are able to make one-on-one contact with folks, but that's just in the very early stages of us being able to do that. So I would say that the data is very immature in that space, but I think we are trying to get more understanding of job sector breakdown from our local health department, because they're really the ones that are gathering that information on behalf of the state. And I think you had a follow-up.
Yes, can you still hear me okay?
Yes, thanks, Brian.
Perfect. And I was referring to for job sectors as far as like a breakdown within the deaths or caseload category, but it sounds like it's still in the infancy stage there. But my follow-up was, so you released K-12 guidance for schools earlier this week in conjunction with other departments. But I wanted to ask about higher ed. Today marks the 2-month warning before UNC Chapel Hill and NC State plan to reopen on August 10th. Is there any plan for your department and or the UNC system to come out with any higher education guidance, or will that be left entirely to each individual campus? I'm mostly curious if there's going to be any blanket enforceable statewide requirements for all colleges in the fall. Thanks.
Brian, great question. Obviously, our urgency around K-12, that is compulsory education, and that is something in our public schools in particular that we wanted to get guidance out as soon as possible. I'm really proud of the hard work that the team did in coordination with our education partners on that. As far as higher ed, we have definitely been convening higher ed stakeholders around how to best do that. How can they best reopen? We are very lucky in our state. I think you know that the acting chancellor of the UNC system is Dr. Bill Roper, former head of the CDC. How lucky are we to have a public health expert at the helm of our biggest university system? I am certainly looking to him for guidance, as he has a great team at UNC, and I know that he is helping us convene the higher ed folks around some of these guidance and practices. At this point, given the guidance the CDC has put out and this ability for convening, I think we likely will put out a set of recommendations that largely reflects the CDC, but really having our partners in higher ed lead here. But stay tuned for that. I think that we're just in those conversations now with higher ed about how we'll move forward with this. I mean, it is a huge challenge. The university's UNC system is enormous across our state, and so we want to make sure that we are protecting not only the students and the staff and the professors that work at those institutions, but the communities that are home to those universities and colleges. So we're working with private and public universities, our community colleges. It's been a very productive dialogue, and I've appreciated that partnership.
Our next question is from Carrie Travis with the Carolina Journal.
Hi, Secretary Cohen. Thanks so much for taking my question today. Asking about prisons in particular, DHHS guidelines seem to now be calling for testing to be available to everyone regardless of symptoms. But I'm seeing news reports that fewer than 6% of inmates have actually been tested in North Carolina. So I was wondering, why hasn't Governor Cooper issued an executive order to test all state prison inmates for COVID-19? And have you made this recommendation to him?
Thanks so much for the question about prisons. I'm not as familiar with the data, so I'd want to go back and review and understand some of the... I wasn't sure if there was a distinction between jails and prisons, federal and state there with the data, so I'll just want to go back. I think Secretary Hooks, head of the Department of Public Safety, has shared that they are doing proactive testing of all of the staff that works in the correctional facility, which I think is really important. Obviously, that's the way the virus gets transmitted into some of those correctional facilities, is through the staff. And then if there is an outbreak, obviously to test everyone. I know we were already testing if there was any outbreak scenarios, and then we would test everyone. I will have to go back and check on this data, but I'm happy to follow up.
Follow-up from Carrie Travis, Carolina Journal.
Thank you, Secretary. I just have one more follow-up question about this. There's this court case, NAACP v. Cooper. A Superior Court judge this week said the state needs a plan for prison testing and COVID-19 prevention. I was wondering, how are you working with Secretary Hooks on this, and what is your plan for prisons going forward?
Sure, thanks for that. Well, when we think about prevention, it's a lot of the actions that we talk about when we think about the 3 Ws and how does that apply into a prison setting. So first was getting folks the appropriate face coverings. And so I know that was work that our teams did together. Then it was access to testing, and then ongoing work to make sure that we are monitoring and looking for any concerns. So we will continue to work closely. I know there's a member of my team who's embedded in the team thinking about prison health on an ongoing basis, and we'll continue to provide support and guidance to our partners in the prison system. Thanks.
Our final question today will be from Rebecca Martinez with WUNC.
Hello, Secretary. It's Rebecca Martinez from WUNC. Thank you for taking my question. It's sort of a two-parter. I'd like to ask if the racial disparities in North Carolina's outbreak data are statistically significant. I also wanted to say that I know that the dashboard shows 10,000 plus cases with missing data on race, and that's kind of a lot since we're looking at 38,000 total confirmed cases. So how accurate is the racial breakdown in the state's dashboard, and which direction does it skew?
Great, thanks. Did you have a second question? Okay, I'll start with that. Okay, So let me start by explaining how we are able to capture our race and ethnicity data, and then how we're trying to capture it in a more systematic way so we don't get the gaps. So often when we get a positive test, as you know, our tracers at the local health department, they call folks up and they report, talk to them about staying isolated. And in that context of it, they capture some additional information. How are you feeling? They capture some of the race, ethnicity data, maybe job, occupation, those kinds of pieces of data. So that's how it's a very manual process of collecting that data. What we're shifting to, and this is thanks to the federal government, is now requiring labs to report race and ethnicity data, which is good because often the information that was transmitted was often just, name, birth date, and just enough information to get that result back to the ordering provider and to the patient, wasn't often capturing race and ethnicity. So we didn't have a systematic way of capturing all of that data. But despite that, I think we've done a very fantastic job, and I want to thank our local health departments for the huge lift of getting that data, because it's so important to guide our work. And what I would say is your first part of the question, is it statistically significant, these outbreaks? The answer is yes. When we see that, for example, African Americans make up 22% of the population, but we're seeing something like 35%, don't quote me on the exact percent, look on our dashboard, right? But 35, that is significant. It is statistically significant, even if you account for the missing data that we have there. So we know that we need to be focusing our response efforts to target what the data is showing us, which is our historically marginalized communities are disproportionately impacted, and so we need to bring our response to meet that data. And that's what we are doing. We need to work closely with communities in order to do that and partner deeply with them. I think particularly at this hard time where there's a lot of distrust, a lot of anger, I think it's even more important that we make sure our messages are clear, that we work with partners close to their communities, that we build and rebuild trust and make sure that we're maintaining it, because I think that's going to be such an important component of us being successful at keeping virus spread low. And again, that just to bring us back of what the goal is overall is really to keep that virus spread low so that we can continue to reignite the economy and ease restrictions. And we all play a part in doing that, right, in keeping that virus level low, whether it's the individual actions you take of the 3 W's, or it's the recognition that you're like, you know what, I went to a protest and I'm going to go get tested this week. All of those actions are things that are going to help us keep the virus level low, identify where there might be increasing spread, and try to surge resources to those communities so we can make sure we're staying ahead of things as best we can. But this virus moves fast. We want to make sure that we're doing what we can to get ahead of it, and we'll continue to work together. We're all in this together. This is not something that we can solve alone from the DHHS perspective, from the emergency management perspective. We appreciate the partnership with hospitals, have been tremendous partners in this, our emergency management, local public health, our community health centers. I could go on. It is going to take all hands to make sure we keep this virus level low. And I have been ringing the warning bell this week to say, look, our trends are going the right direction. Let's jump on this now and see if we can make those trends go back to level and decline, and not continue to see them go in the wrong direction. And that's what we're going to continue to do. Director Sprayberry and I will get back to work, and I appreciate you joining us and happy to answer your questions. Thank you.